Now, you may well be no stranger to strep throat. The bacteria that causes that can exist everywhere: noses, mouths, skin. But in rare cases, this common bacteria can become invasive and enter parts of the body it doesn't normally go. At its worst, it can become a severe flesh-eating disease, sometimes even be fatal.
Kiss me, kiss me, kiss me.
In the back of my leg, it looked like a big, huge blister, but the color of a bruise. And my whole arm was red and purple.
Like, if it's going to save her life, take it off. We'll help her. We'll get her through this.
Like, I don't sleep at night properly. It's literally been the worst time of my life. I went in and I did CPR and I was crying. I was holding her hand. And I was telling her, you know, please wake up. Please, like, wake up. I hold him and then it gets to a point where I can't. Because it just haunts me.
Loved ones lost. 24-year-old mother. Limbs amputated. Those are some of the recent stories that we have had for you on CBC News that highlight the dangers of this invasive strain of Strep A. And they are stories that have caused concern, have many of you asking questions about your own safety. And so we bring in a specialist to help answer those. Let's say good morning to Dr. Isaac Bogosh, who's an infectious disease specialist at Toronto General Hospital, my guest this morning, and thank you for coming in.
Thanks for having me.
I mean, we really, with those cases, we really see the extreme form, but help us understand, number one, Strep A.
Yeah.
How common is it?
Yeah, so group A streptococcus, it's a bacteria. It's very common. It's everywhere, and it lives in the back of the throats of some children, rarely in the back of the throats of some adults. And the vast majority of people that get this infection will either have no symptoms at all, in which case we say people are colonized with the bacteria. And then once in a while it causes an illness, and usually it's a very mild illness. We get strep throat. Many people in the audience will have experienced that. Sometimes it can cause some very mild skin or soft tissue infections. These are easily treated with antibiotics. Rarely it can be invasive and cause the serious illnesses that we've been seeing.
That we've been talking about. Rarely. And let's bring up some numbers, because it's not as rare as it once was. If you look at the Public Health Agency of Canada, here's the graph that shows us starting in 2002, 866 cases reported across the country. All the way up to 2017, those numbers more than doubled to at least 2,178. And that doesn't even include Alberta, New Brunswick, Nova Scotia, Nunavut, PEI, or Yukon. So only about half the country in terms of numbers. The numbers are going up. Why?
It's hard to know exactly why the numbers are going up, and that's still a bit of a mystery. What we do know is that there are many types of group A streptococcus out there. We like to call it group A streptococcus and think it's one thing, but in fact there's several different strains of it, and certain strains might be more prone to being invasive than others. And when I say invasive, what I mean is that it can get into the bloodstream, it can affect some of the internal organs, and people can get rather sick from that. So it might be certain strains of the bacteria that are more prone to this. This might also be partially reflective of better surveillance of the bacteria as well, and perhaps it's more prevalent than we initially thought, and we're just detecting it better these days.
So invasive because it invades parts of the body where
100%.
it doesn't normally go. Would it be possible that in addition to the strains maybe being different, somebody's own immune system may be different, and that may make people more susceptible or less?
Absolutely. The bacteria, and when it becomes invasive, it's a bit of a dance between the bacteria and the person that it infects. So not only are some strains more prone to becoming invasive, but there might be something unique about the individual that it's infecting that might make this bacteria more prone to infect them. Maybe a quirk about their immune system. Maybe they're overtly immune compromised. And sometimes people have ulcers on their skin or other medical conditions that might make them more predisposed to having a severe infection.
Okay, so there's all sorts of reasons. As I mentioned, it is still a little bit of a medical mystery why this changes, becomes this invasive form. Yeah. Then in terms of diagnosis, we saw one of the women who had to have legs amputated as a result. The difficulty of diagnosis and treatment, what happens when it does become this invasive form?
Fortunately, this is not hard to diagnose. It's a very easy bacteria to culture and to grow in a lab, so it's not that hard to diagnose. The problem is if someone has an invasive form of group A streptococcus, they get very sick very fast. And people will be hospitalized. People are sick enough to be in hospital. So the diagnosis isn't challenging. But people get very sick very fast, and sometimes there's a profound inflammatory response of the body in reaction to the bacteria, and this is causing some of the disease that we see. Similarly, treatment is rather straightforward as well. I know people have bad outcomes sometimes with invasive group A streptococcus, but antibiotics such as penicillin are very effective against this.
Okay, but the speed with which this is administered
it's
is
got to be
key.
nipped in the bud.
Okay, so as I let you go then, let's get the doctor's tips for people how to prevent one of these forms of infection.
Absolutely. So we like to think of it at an individual level and then at a public health level. And at an individual level, you know, this bacteria is in a lot of places. We have to have good hand hygiene. Just wash our hands, wash our hands, wash our hands, and really be appreciative of that. At a population level, this is really a matter of ensuring that more marginalized communities that might be more predisposed to this, or anywhere that people cluster together closely, we have to make sure that there's good sanitation and hygiene in settings where there's a lot of people clustering close together, because that's a situation where people can transmit the infection from one person to another.
So we're talking homeless shelters, we're talking facilities for intravenous drug owners, users. Again, this is at the margins of society.
Absolutely. It is more common in those settings.
Okay, so on both levels, individual and institutional, some simple tips.
Absolutely.
All right. Thanks for coming in.
Thanks
Pleasure
for
to have
having
you
me.
here. In answer to the concern as we bring you these stories, Dr. Isaac Bogosh, who's an infectious disease specialist at TGH. Thanks.